The information contained in this video is for educational and entertainment purposes only. It is not a substitute for an eye exam. If you're having eye problems, get an eye exam immediately, preferably by Dr. Weaver! Hello, I'm Dr. Weaver. Welcome to Dr. Weaver's Awesome Eye Tips. Ow! Diabetes can affect the eyes, either a little or a lot. Now, if mild, changes to the retina caused from diabetes can be reversible. However, if diabetes goes unchecked, the changes to the retina can be severe, and those types of changes may cause permanent vision loss. You probably already know this, but diabetes is a condition where you have high glucose levels in your bloodstream, which affects all of your organs, including the eye. If you do have diabetes, the recommendation is for you to get your eyes checked out every year, just to make sure that those pictures I showed you earlier aren't happening to your eyes. And in addition, you should be seeing your family doctor more frequently than that. The amount of sugar in your bloodstream depends on your diet and how well your body processes that diet. If your blood sugar is going up and down a lot, that's going to cause your vision to fluctuate. But if you keep your blood sugars at a low and stable level where they should be, that will minimize any chance of any complications that can happen in the back of your eyes, and that will give you stable vision as well. A sensitive topic associated with type 2 diabetes is weight loss. Some patients don't like to hear about that, but weight loss is an enemy to diabetes. Kapow! Take that, diabetes! If you have diabetes, you probably have heard of the medication metformin. It is a very common medication for those with type 2 diabetes. Medications are indicated and are helpful in treating diabetes to help control blood sugar levels. But with any medication, you know that there can be a lot of side effects. Exercise is another way for you to help control your blood sugar levels. A recent study from the Diabetic Association showed that regular walking of 30 minutes a day can effectively control your blood sugar better than taking metformin. Controlling your blood sugar levels improves with modest amounts of weight loss. Another study showed that losing 10 pounds from your frame, no matter what your starting weight is, had a significant improvement on blood sugar levels. I see patients all the time that tell me that they've had a significant amount of weight loss and their family doctor takes them off of diabetic medications. So I'm not suggesting that you should stop taking your medications, but what I am suggesting is that if you do add exercise into the mix, your family doctor most likely will be surprised at how well your hemoglobin A1C is at your next visit. Hopefully your family doctor has recommended that you do check your blood sugar levels at home, because there really is no other way to know how your body is reacting to what you eat and what you do. Along with all of the other things that I mentioned, probably the most important thing is the diet. If you're not eating right, your blood sugar levels are going to be all over the place. So if you have already met with a dietitian, then you are definitely on the right track. But if you still don't know what to eat or how to control your blood sugar levels that way, there's actually an app out there called MyFitnessPal. It's free, and it's not just for people with diabetes. It's actually an excellent way to set weight loss goals because it can track your diet, your caloric intake, and it can also track all the exercises that you do, all in one convenient place. I have no financial interest in MyFitnessPal. I just feel like it's a great app to get you started to set some weight loss goals and to track what you're eating. In summary, get your eyes dilated every year. That means getting an annual eye exam by an optometrist or an ophthalmologist. Make sure you see your family doctor more frequently than that. They usually like to see you every 3 to 6 months just to see how that blood sugar is doing. Speaking of your blood sugar, make sure you check it at home and control that blood sugar by taking your medication, eating right, and exercising. And if you need help with your diet or losing weight, consider downloading an app like MyFitnessPal to guide you along the way. Doing all of this will greatly reduce the risk of diabetes negatively impacting your life, such as diabetic retinopathy, and you don't want that. Thank you very much for watching this episode of Dr. Weaver's Awesome Eye Tips. I'm Dr. Weaver. Take care.